I've become aware over the past 2 years or so how difficult it was to land the learning from serious incidents, never events, and actually disseminate those key points of learning and get the actions embedded across the organisation. There's something about finding recurring themes that should never happen. So we tried a range of communications already, all the existing ones, and it hadn't worked. So my idea was that by holding a conference and getting everybody engaged, that we might actually start to make significant progress.
The first Safety and Quality Conference was held at Royal Bournemouth Hospital in September 2015. RBCH needs to be an open and transparent organisation where clinicians are able to talk freely when things go wrong. Preventable errors can and do happen. We need to be able to learn from them in a non-judgmental and blame-free culture. One of the principal aims of this week-long conference was to share key points of learning widely across all staff groups, so that in the future our patient care is as safe as possible. The main conference was attended by over 350 members of staff from across the Trust and was a fantastic opportunity to hear very frank and honest talks from a range of clinicians on what happened when things went wrong and what we have learnt from these events.
We actually had a never event in our department, and I think I've been very, I suppose, relieved and pleased with the process that I've seen here this afternoon and our own experience. It was very difficult at the time, but everyone standing up here and sharing their own experiences so that everyone can learn from that, I think it's been incredibly valuable.
Well, we were unfortunate and went through 2 never events, and it's just nice, well not nice, but it's interesting to hear that other areas in the Trust have also gone through serious untoward incidences and their process of improving things for patient safety.
Well, I think that seeing consultants stand up and explain that they've done things wrong and they've been directly involved with episodes where care hasn't been up to scratch, they're the people that we look up to and who we're all they're our bosses, but also people who we aspire to work like. And if they're the top-notch consultants admitting that they've done things wrong and that they've had, their involvement in things have not always been positive, then it encourages people from all levels to admit to having made mistakes, really.
Learning from mistakes, hearing about what's going on in the Trust will make people think about what happens in their area, maybe use that learning from that to help prevent the errors happening elsewhere. I think it's really important that we share that information. I'm not a clinical person, so for me it's good to hear that and that honesty with patients as well.
The perception, I think, as a doctor and probably for other staff, if something goes wrong, you can't really do anything about it. You can't say, well, this went wrong, because you fear you're going to be blamed and it's going to, it'll make your life become very difficult. I'd actually say the contrary to that our experience within the Trust has been, I think, very positive. We were freely able to discuss the episode that went wrong, and a lot of learnings come out of that, and I think everyone reflects back on it and thinks, actually, while something did go wrong, an awful lot of good and change has happened. And I think if that cascades through the Trust and everyone can do the same, then the standards all around will increase.
What has been compelling for me is listening to clinicians being able to explain the emotional impact, not just for the patients, but on themselves and on the teams in general, and how you work through that process, and it becomes a very positive process, not just for patients, but for the teams. Absolutely fantastic to hear them talk.
There are also talks on our growing number of quality improvement campaigns, which will help ensure these events do not happen in the future, including the World Health Organization Safety Checklist campaign, Never Get to Never. During the week, over 100 staff attended our open space, which was an opportunity for them to say what more we could be doing to help improve quality and safety at RBCH, with a range of interactive displays.
Events like this are really good. There seemed to be a real mixture of people here, ranging from doctors to nurses to theatre staff to management. So I think that involving people from all levels and also encouraging people who are sort of less senior to have a voice to speak out is a really good idea.
I think we need to celebrate the fact that so many people have turned up today and been interested. We ought to listen to the lessons that have happened by individual incidents and make sure that we get those messages out to the organisation in a way that people hear them and know that they've got permission to do the things they're being told to do today.
I think it'll have a very positive impact actually, and empower staff from the bottom up to actually report things and make things better.
After the event's success, the Safety and Quality Conference will become an annual event at RBCH, with other events being planned in between to continue the sharing of learning throughout the Trust.
We set ourselves the vision as a Trust to be the most improved Trust by 2017, and that firmly links into safety and quality. So anything that we can do to reduce avoidable harm, to reduce mortality, increase safety and better the outcomes, that would need to be, that I would want that to be the legacy of today. I don't see it as an end point at all. All these aspects are a continuum, and we will need to keep up our efforts. We will need to repeat this conference next year.